How long does TrichoStem Hair Regeneration last?
I've watched platelet-rich plasma or PRP injections or ACell plus PRP injections being promoted as treatments for hair loss over the past few years. I created the TrichoStem Hair Regeneration treatment system in 2011 after establishing a highly effective, long-lasting procedure combining acellular matrix with PRP for hair loss. I'm amused to hear patients ask me how TrichoStem is different from all these other PRP treatments. It's funny how when I first developed this treatment, I was an outlier when almost no one else was offering this type of treatment. More than a decade later, after medical retailers everywhere are offering PRP or PRP with ACell as a monthly treatment with a minimum of 5 sessions and no clear expectation of longevity, I continue to be an outlier since I'm helping my patients have results lasting 3 to 5 years and longer with only 2 sessions 18 months apart. I developed TrichoStem Hair Regeneration from the ground up after using acellular matrix with PRP to help improve the results of hair transplant surgery. The benefits of TrichoStem Hair Regeneration is in the reactivation of hair that is in a prolonged resting phase and the thickening of thinning hair. Scalp coverage is dependent on maximizing these two very important variables. I further developed ways to work with acellular matrix and PRP for specific approaches to hair loss based on individual hair loss profiles. This contrasts with what's being offered by these medical retailers of PRP, since their schedule of treatments are the same whether you're a young male with aggressive hair loss or a middle-aged woman with postmenopausal hair loss. I spent years working with different formulations and delivery methods and further developed several categories of hair loss, including male and female androgenetic alopecia, traction alopecia, scarring alopecia, and post-hair transplant treatment. Every patient receives a customized treatment plan for their hair loss classification. I see patients every 3 to 6 months for the next 2 years. During a typical visit, I take standardized photos and show my patients comparisons with their previous photos. Hair loss management takes time and thoughtful individual attention. I continue to refine my systems, and now more than 10 years later, and having treated hundreds of patients every year since 2011, TrichoStem Hair Regeneration remains unparalleled by any other non-surgical treatment. As I mentioned earlier, TrichoStem Hair Regeneration is well proven to have benefits lasting 3 to 5 years or even longer with only 1 to 2 treatment sessions. The second treatment is usually done at 18 months after the first one. I'm flattered that the PRP and ACell plus PRP treatments in the market today try to follow the success of TrichoStem Hair Regeneration, but these treatments have come up short. Sadly, we've even been informed that some practitioners are actually stealing our before and after photos and representing them as their own. I've been seeing a lot of people who have been going to practitioners offering generic PRP or PRP+ACell. It seems that most of these practitioners have little knowledge or experience managing hair loss, and are only interested in quick, profitable transactions. I'm committed to our patients' successful results. With regular follow-ups in our offices or even virtually every 3 to 6 months for a typical 2-year plan. I also continue to monitor results every year to 2 years afterwards. I hope you found this information from my experience helpful. If you're interested in recommendations for your individual situation, you may contact us through our websites or call our offices to schedule a consultation. Thank you.